Hi, my name is Chloe Wohlers, and I'm currently a student trainer enrolled in the Sports Medicine 3 program here at South Tahoe High School. For my second project, I decided to create an injury prevention program that focuses on rotator cuff tears in baseball pitchers. To start things off, the function of the rotator cuff muscle complex is to maintain the ball of the shoulder so it's centered within the socket of your shoulder blade. A rotator cuff tear is a rip that impacts these group of muscles and tendons that help stabilizes this shoulder joint. This tear is a highly common injury, with around 2 million cases in the U.S. yearly. There are two types of rotator cuff tears. A partial tear is when one of the shoulder muscles is frayed or has sustained some damage. A complete tear goes all the way through the tendon or pulls the tendon completely off the bone. This tear ends to lead to surgery in order to stitch back together the torn area or reattach the tendon to the bone. After surgery, physical therapy is super important in order to have a safe and successful healing process. Baseball pitchers are constantly stressing their rotator cuff muscles, putting them at risk of a tear. Though these tears are more common in older patients, usually beginning around the age of 60, it can still happen to younger players because of this constant overuse and strain that they put on this muscle. The client I worked with for my second project was Cameron Gerner. Cameron is a sophomore at South Tahoe High School, has been playing baseball since he was 4 years old. Last year, he was on South Tahoe's varsity baseball team for the short season they had. He has also been pitching for 5 years. The goal of the program is to reduce the risk of my athlete tearing his rotator cuff in the future. In my program, I focus on the four main muscles of the shoulder blade that is engaged while pitching. These muscles are engaged when throwing and is super important to keep conditioned in order to prevent injury. The supraspinatus muscle centers the ball within the socket as the arm is being raised. In pitching, this muscle is most active during the transition from the stride to the arm's cocking phase. The infraspinatus muscle externally rotates the humerus and stabilizes the shoulder joint. In pitching, this muscle is engaged in the arm cocking phase as the shoulder maximally externally rotates. The subscapularis rotates the head of the humerus medially and adducts it. It is highly activated in arm acceleration. Finally, the teres minor produces external rotation of the shoulder and assists in adduction and extension. In pitching, it assists in the arm deceleration after the ball is released. Here are the 6 phases to baseball pitching. The rotator cuff is most active during the arm cocking through arm deceleration phases. These are the phases where the greatest stress is placed on the thrower's shoulder and elbow. Also, most overuse injuries occur due to the repetitive stress during these phases. A strong and healthy rotator cuff is essential to withstand these stresses. Before I started the program, I had my client send a video of him pitching just to see his positioning. Baseball pitchers are known to quickly developing proper techniques, and due to his years of experience, I did not notice any correlations in his pitch that could increase his chances of a rotator cuff tear, except for the constant overuse of overhand throwing. But there's nothing you can do to correct it besides conditioning the shoulder complex and avoid overuse. As you can also see in the video, I took note of each sequence during his pitch. Then I completed some testing. I tested my client's rotator cuff strength by testing the strength of the four most important shoulder muscles. First, I tested the strength of his supraspinatus, also known as the empty can test, which is where the shoulder muscle is most commonly injured. His arm is abducted to 90 degrees, forward flexed to 30, and the thumb is pointed down, even though it is not shown in this photo. I asked him to resist downward pressure. Then, testing his infraspinatus and teres minor with his arm abductive, both sides 30 degrees. My hand were placed outside of his forearm, and I asked him to externally rotate both arms as I added resistance. Finally, I tested his subscapularis by doing the Gerber's lift-off test, which tests for internal rotation. My patient's hand was behind his back, and he pushed his palm off his back into mine. Pain or weakness in any of these tests would have suggested signs or symptoms of a rotator cuff tear or injury. For the empty can and Gerber lift-off tests, I conducted the tests on both arms in order to compare the strength and determine the weaknesses. After these tests, my patient reported of no pain or difficulty in completing them, and I noticed no weaknesses when doing them. I also did some distance testing with my client on how far he could throw the ball. I conducted the test 3 different times, each with a different % of effort prior to the program and after. Though my program was not designed to increase his distance when it came to throwing, I still wanted to have a general idea of how far he was able to make his pitches and to see if this program was able to increase or decrease his distance. We measured the distance using a measuring tape he provided, and in all, he was able to throw a little farther. The warm-up consisted of 4 simple stretches that helped warm and activate his muscles. Pendulums warm up the deltoids, supraspinatus, infraspinatus, and subscapularis. The crossover arm stretch warmed up his posterior deltoid. The arm reach stress worked your latissimus dorsi and triceps brachii. And finally, the doorway stretch was done in 3 different poses, all activating your pectoralis major and pectoralis minor. My program was quick and easy to do, with 3 reps, 20 seconds each. The program consisted of lawn mowers, which activates the trapezius and serratus anterior muscles, side-lying external rotation, working the infraspinatus, teres minor, and posterior deltoid, and the interior side-lying rotation works the subscapularis and teres minor. Reverse flies works the rhomboid muscles in the upper back and shoulder region. The standing internal and external rotation works the same muscles as the side-lying exercise. Standing rows work the middle and lower trapezius. And finally, the trapezius strengthening exercise works the middle and posterior deltoid, supraspinatus, and middle trapezius. Overall, this program was successful. Not only was I able to implement new exercises to my client's routine to help strengthen an important muscle group that is constantly stressed in pitching, but I was also able to educate more upon a common injury that can occur in a sport he has passion for. I hope this program can be implemented to the baseball team in order to try and prevent a super common yet career-ending injury if not treated properly. Thanks for watching. If you have any questions, my contact info is located